Section 3 is with Dr. Scott Ahlschwede. He spent 15 years at Rood and Riddle, and he's a partner at Rood and Riddle in Lexington, Kentucky. He moved here with his wife, Patty, in 2012. And as many of you know, he is operating and managing and running Rood and Riddle's new facility here in Saratoga, and clearly making his presence known to our breeding community in New York State. But we're happy to have him here. We're happy to have Rood and Riddle here. And without further ado, Mr. Scott Ahlschwede.
Thank you guys for having me here. It's a hard act to follow up behind them. They're legendary. This is one of my favorite terms up here. I'm just going to stand out front and walk around and pace. But reproduction is a luxury. And everybody tends to forget about that. It's the most important thing. We got to get her in foal. But sometimes we got to make sure everything else is taken care of with that mare first. You know, if we have a 19-year-old mare that had a fractured pelvis and she can barely walk and she has a hard time getting up, your expectations should be lower. So we always go back to reproduction as a luxury. And then the other few little things I want to add on, you know, Dr. O'Kane and I, we do things differently, but we get to the same. The goal is the same at the end of the day. There's a lot of ways to do things right, and I think it comes down to your relationship with your practitioner. You learn from each other. You understand the economics of the work you want to do on your mares. Some people want to do a lot more. Some people want to be more careful. You work together to get a live foal at the first of the next year. And I think that's what we're all shooting for. In breeding season, we get excited and we just want a pregnancy. We want to see a pregnancy, but we ought to remember that a live foal the next year is what our end goal is. So today we're just going to go over the basics of what I do in my practice and how I manage mares. And I do it a little different for some clients than I do from others. It's nothing's black and white, but we're going to kind of see the perfect world. This is how I recommend to manage my mares. So we'll start talking about a fall evaluation, and this is not a big in-depth exam that's going to take a lot of time, but it's December 1st, and we need to know which mares are barren and which mares are pregnant. And so we're going to go through and we're going to check all of our mares and make sure we don't have any barren mares and we don't have any surprises. But you know, I use the ultrasound a lot. It's a tool that the technology's really advanced in the last 15 years. And so I use it on every exam now, and so it's a perfect opportunity. I can run an arm in and say, the mare's pregnant, but while I'm there, I might as well put in the ultrasound, look at the mare's placenta, make sure she doesn't have some signs of an ascending placentitis. It's also a good time. I'm going to talk about Kasliks, the Kasliks exam a lot, which are just a nice little pictures on it, but I don't want my mares that are due in April, I'm going to recheck them. If they're sucking ear or they're caved in a little bit, I might tack them down a little bit further. So there again, nutrition, comfort, pain, we want that mare to be happy, well fed, doing well. That's going to result in the best foal in the spring. Then the other side of that, we might find a barren mare, and then we have some other mares that are barren, so we're going to do fall evaluation of our barren mares. So, you know, we're going to just do a basic reproductive exam. We're going to do an ultrasound. We're going to stick a speculum in. If we see an abnormality, we're going to take a culture. We're going to check her Kasliks. The fall evaluation on barren mares is typically, it doesn't yield high results. Most of these mares are dormant. Their uteruses look different than they're going to look when they're cycling after they've been under lights for 60 days. But we're going to look for obvious problems. Pooling a bunch of urine, a uterus full of fluid. Basically, we just check them out, make sure nothing's obvious, and then we're going to start them under lights, and then we're going to learn about Equine here in a little bit. There again, I have nutrition, comfort, and warmth. So we get through that. We make it through the holidays. Everybody's getting geared up in January, early February. We've had our mares under lights. We're starting to tease our mares. We're starting to see if farm managers have followed the mare cycle a couple times. They're having heats. So then we have a few other things to think about and talk about. Breeding season's going to start February 10th, February 15th. There's several hormone therapies available that people use differently. We're going to check these mares out. We're going to think about programming these mares, is what they call it. A typical mare will shut down in the wintertime. We're going to put them under lights to try to get them cycling again. But there's a transitional period where they go from a non-cycling mare to a cycling mare. And they grow little bitty follicles, and they may take days and days and days to ovulate. So we're going to start following some of these cycles. And then the hormone therapies are some old remedies, or there's a lot of research and studies on how they work, but we can affect these mares with hormones and then give them an injection like prostaglandin, and we can help some of these mares come out of transition or have their first ovulation. Honestly, I used to program a lot of mares, but in general now, I think for me in my practice, in my hands, if the mares are cycling, if you have mares that are that you've had under lights, I think a little bit of patience. I think you can spend a lot of money and you can give a lot of hormones with not too many results. In the right hands, if you have the right numbers of mares, it's worthwhile. Buserelin I have listed there, and that's another hormone, and sometimes we've all had mares that won't cycle whatever we do, and that's a hormone that we'll use. It'll actually help us grow a follicle. But a mare that has, which I'm gonna flip the slide because we're gonna talk about these mares coming off the racetrack, the maidens. They're coming to New York. It's winter time. It's a cold shock if they're coming from the south. Those mares, if they have no activity on their ovaries, it's going to take a long, long time for those mares to cycle. Those maiden mares are probably one of the biggest challenges we all face. In my experience, you have a maiden come in and you check her and she's either cycling really well and she's ready to breed, or you have nothing and you're going to have to be patient, because we give a lot of hormones and we try to make those mares come on and cycle faster, but typically nothing works. It's frustrating. Patience, sunshine, and green grass is going to help these mares more than anything. But you have to work with your veterinarian. There's always pressure from the owners to get the mares bred. So we try different things. We go to the hormones like the Buserelin, and sometimes we have success, but they're very frustrating. So we're going to go back to our Baron mare exams at this time of the year. And in my practice, the Baron mares are mares that they're not pregnant for a reason. There was something that happened last year. So obviously their fertility is not as good as your Foal mares, generally speaking. And for me, I want to get that mare pregnant on the first cycle, because you breed them, normal mares, they get bred, they get inflamed from breeding. And problem mares have trouble clearing the inflammation. That's their number one problem. They have to clear the inflammation. So the first time they get bred, they're going to have inflammation. And if you're not successful on the first time, they're going to get harder and harder and harder. We're going to have to work harder, and it's going to cost more money. So I do everything I can to have that mare pregnant, cycling, set up perfectly for the first time I breed her. So, we do the basic exam. We look at the fluid. We get a culture. We put a speculum in, make sure there's no signs of pooling urine. It should be red, comma, urine, comma, cervical defects. We're looking for any clues that what can we do to help her right now before we breed her so she's right on that first time. Dr. O'Kane mentioned the culture, the cytology. Sometimes if there's a little fluid in the uterus, we'll flush a little fluid in and get it out and culture that fluid directly. And then the calyx, again, is critical. Here's a nice set of pictures of a mare. And she's very caved in. She has very poor conformation. And on this mare, we actually did what we call a perineal body reconstruction. We've kind of rebuilt her here. We've done just a minor surgery that we do on the farm next to the stall, but we've rebuilt this area to have less collapse, so she's not able to she can clear better. She's not going to have contaminants. I want to talk about the Kazakh. This is probably a good time. In my mind, a normal mare clears her uterus. They get bred, and then they have to clear the debris. And a misconception, everybody's always worried about stuff going in, but the biggest thing with the Kazakhs is there's a pressure gradient. If there's air going from the outside in, the mare cannot clear herself. So the big key on a Kazakh is to seal that area, and that way she doesn't have any negative inward pressure, and it improves the mare's clearing outwardly. So those are our barren mares. We're going to get them ready. We're going to talk about our post-breeding things here in a little bit. We're going to talk now just a little bit about our foaling mare management, and this is kind of the perfect case scenario, what I do in my practice. Typically on a mare, she has a foal, everything goes well. I think we usually do a brief exam on that mare the next day. I think the most important thing that you guys as mare owners can do is take that mare's temp for the first 3 days. We want to make sure all of the placenta is out of that mare. So either you better know for sure, or you have your veterinarian examine the placenta, because that can lead to a lot of problems. They can get sick. They can get a very inflamed, dirty uterus. Placenta out is the #1 thing post-foaling with that mare. We look them over. We make sure they don't have any lacerations. Check that temperature. If they're not eating up, they probably have a temperature. Mares that have a temperature, a lot of times the placenta's out, but they've been contaminated, and we'll go in and we'll flush that mare's uterus. Some of these mares will have a lot of fluid. These are older mares. They just had a 110-pound foal way down deep in their belly. That uterus is all down there. They can't get that fluid out. So we'll help those mares out by removing that fluid, treating them with antibiotics and anti-inflammatories. So that's a small percentage of mares. Most of the mares are fine. The next thing I like to do what I call spec Kazakhs on my mares at 3 to 5 days post-foaling. And it's basically the same thing. I'm going to just put a speculum in the mare. I'm going to look, make sure that she's clearing her fluid. If that mare has a lot of pus, a lot of fluid, that's going to be my opportunity to intervene early and flush all that out. And the goal on all of this is to speed up the process. I want that mare to be ready to be bred back sooner. And I'm going to go ahead at that time, and I'm going to put that Kazakhs in place. And some mares are perfect behind. Maybe I don't suture them, but I probably suture down 95% of them if I have the choice early on. And I breed a few mares selectively on full heat. Dr. O'Kane and I are a little different, but I like to be patient and give these mares time to come around. I do breed a lot of mares on short cycles, and if I can have them sutured down for that next 15, 20 days, I think at the end of the year, I think my conception rates are better if I do that Kazakhs earlier than later. So then we go to the full heat. I do like a full heat exam. I like to do it day 10, day 12. Early in the season, I don't breed very many mares at all on full heat. My criteria for full heats, I typically don't breed a full heat mare before day 10. So I'm waiting for the ones that are going to hang on a little longer. I want the uterus to look really good. I want to make sure they don't have any fluid. I want the uterus to feel good. So if early on at 12 days we have a mare that hasn't ovulated, she's having a great heat, and she looks great, we'll take a shot and breed her. Because a full heat is a great heat. But the other thing I'm checking at day 10, and the other thing I'm doing, I'm just looking for an ovulation. I'm trying to document that she had an ovulation. And then that means that brings us to short cycle, which I don't know if you guys are familiar with that, but it's a mare. A normal heat's going to be at day 10 to 12. They're going to have a full heat, and then they're typically going to have a heat around 30 days. A short cycle is where we use a prostaglandin. Lutalice is the brand name, and we're gonna cause that mare to come into heat sooner than her 30-day heat. And I'm just looking. We had pictures, and I don't know what happened to all the pictures. Typically, so So I've marked an ovulation. The mare looks good. We're going to go to, we're going to give the mare probably 5 to 7 days, depending on when we estimated her full heat ovulation. And then I'm going to re-examine that mare, and I'm going to look for a corpus luteum, which is where she had a previous ovulation, and then I'm going to look for a nice 20 millimeter follicle. Those are my favorite mares to short cycle. I give them the prostaglandin, and the predictability of the growth of that 20 millimeter follicle is going to be 5 to 7 days. And this, in the times of busy stallions, I think I've short cycled a huge percentage of the mares in my practice in the last 10 years. And I can predict that follicle. In Kentucky, on really busy stallions that have 170 mares going to them, I can short cycle the mare and we can book the mare for 6 days out right then. Then we come back in 2 days, we look, the 20 is now a 30. 2 days more, she's coming into good heat and she has a nice 40, and we've already have a spot. We give her our ovulation product and we send her to the shed. I have teaser thrown up here. Teasing these mares is great. It's tough on foaling mares. The thing about the short cycle, if you're a small farm, you don't have a teaser, it lets you know exactly where that mare is, and you've been following her, and you're not going to miss her. Sometimes the 30-day heat is another fantastic heat, and sometimes for various reasons, older mares, we let mares go to their 30-day heat. But sometimes if you're a small farm, you don't know exactly when your mare is going to be coming into heat. Sometimes they take longer, and your veterinarian's going to come out and check her. No, she's not ready. They're going to come back. They're going to come back. For me, using the short cycle, I can kind of program it a little bit more, which gets us to 30-day heat. If we do decide to breed on 30-day heat, and I do a lot of mares we breed on 30-day heats, I typically check them 25 to 26 days to see if they're starting to come in. And I'm talking about in heat, and for me, in using the ultrasound, I'm looking at the uterus, and I see changes in the uterus, signs of uterine edema. I see the follicle growing, and those are the measures I use to determine heat. So we got her to the shed. We bred the mare. Here's a little bit about what I like to do post-breeding. And in a perfect world, I would check every mare the day after I bred her. And the main reason for that is I'm not really looking for ovulation, because most of these stallions are fertile for 2 days, some of them way longer. But I want to see how that uterus looks. So maiden mares, young foaling mares, there's a lot of mares I don't check for 48 hours. But anything, my barren mares that are problem mares, my mares that are on repeat cycles, I love to look at those mares the day after they're bred, because if they have fluid in their uterus, that's not normal, and they need help. And we need a lavage of uterus, we need to do antibiotics infusions, we need to use a lot of oxytocin, a lot of estromate, we need to help them. And that's going to help us with our conception rates. So, you know, we're looking for fluid post-breeding, and that's the biggest thing. Did they have an ovulation? We want to know that, of course. Day after, if a mare hasn't ovulated, I'm not really worried about it. I know where that mare was in her cycle. I think we're going to probably be okay. We'll usually follow them up with an OV check. Sometimes we do, sometimes we don't. If they look good post-breeding, Caslix is done, we're done with them. Mare has a little bit of fluid, I might infuse some antibiotics. The mare has a little bit more than that, I'm going to lavage them, flush everything out, put in antibiotics. We're going to go with our oxytocin, estromate, and possibly systemic antibiotics. I mean, the oxytocin, Dr. O'Kane, it's the greatest drug ever invented for the mare's uterus of all time, I think. And it's extremely cheap. Farms can use it, and I think we should all use it more. I think people get complacent and they forget to use it. Giving it to every mare post-foaling, I don't like to do it the first day or two because I'm worried about cramping them up too much and maybe make them hemorrhage, but getting them outside, running around, and getting them oxytocin, it tightens the uterus, and it helps them so much. So we just have to, it's so easy and so effective. Can't talk about it enough. So that's my typical breeding management on post breeding. You know, I'm going to talk. You get to your repeat cycles. So you bred her, she's not pregnant. We're hoping for a high conception rate for whatever reason. To get 70% is probably a really good number on your first cycle returns. And there's always mares that we don't have a reason they don't get pregnant, but time is of essence. We don't have that much time. Breeding season starts and ends fast, and everybody wants early foals. So we have increased pressure. We're going to be more aggressive with the mares. We're going to go in. They're coming back into heat. We're going to get a culture and cytology as soon as possible. That's the other big challenge. We did a preg check at 15 days. She wasn't pregnant. We're going to have to breed that mare right back in 5 days. We don't have any time. We have to get the mare needs to be in heat so we can get our culture, but we're going to have to be booking the mare, getting a time set up to breed her, and we're going to be waiting our lab results. But we're going to just jump in there and we're going to get her as good as we can get her as fast as we can. Some of these mares, I just have more aggressive fluid management post-breeding. I'm going to try to check all those mares the day after. Some of those mares, if I know their problems, Dr. O'Kane mentioned, I'm going to come in 4 to 8 hours post-breeding and I'm going to lavage the mare. Normal mares clear the inflammation. These problem mares don't. We're going to get in there. Semen causes inflammation. We're going to get in there and help her get all of that out. We're going to get it out, get her quieted down. We're going to give her oxytocin and or estromate. Estromate is a drug that it's a prostaglandin compound. It's called it's cloprostanol is the name of it. It's a drug that I use a lot on mares the day after breeding. The oxytocin is very fast to work and it causes contractions, but they only last for a short period of time. Estromate is a drug that causes a little bit different type of muscle contractions in the uterus, but it lasts about 6 hours. It kind of gives a longer, slower contraction. So New York's a big place. Farms are spread out. It's tough to get back 4 to 8 hours post-breeding. And it's expensive to call your veterinarian and say, I need you to come do this one mare at 11 p.m. I've gone on a lot of mares. I give them a shot of estromate 4 hours post-breeding. Now, estromate's a drug that once they ovulate, you want to be real careful about giving it. You don't really want to give estromate to a mare that's ovulated. So there's a narrow window of use, and you need to work with your veterinarian if you're going to use it. So we got them bred, we worked on them, we did everything we could, so now we're going to just talk about timing of our preg checks. I typically like to do preg checks 15 days for breeding or 14 days from ovulation. And for me, it's just always say 15 days from breeding, and it's an easy time to pick. She probably ovulated the day after, so that's 14 days. There's some other mares, if you say, we're going to do her 14 days from ovulation. Well, if you didn't check her for 2 days and she ovulated exactly when you bred her, it's already going to be a 16-day-old embryo when you check her. And if you have twins, they're going to be getting big, and it's going to make your twins a little bit tougher to deal with. So 15 days from breeding is what I like to shoot for. I typically, they grow a lot. That's what I was going to say. They grow a lot from 14 to 16 days. So that's a nice 14-day-old embryo. Everything looks good. A lot of people like to put a lot of mares on progesterone products. So when we check them pregnant, we can do a progesterone blood, make sure that our progesterone number is good, and we don't want to put her on Regimate. The main number one reason we're doing these checks early, though, is for twin management, because most of these mares are growing multiple follicles. We are giving an ovulation product to increase, it increases our conception rates. It's increasing ovulation, so it's hopefully minimizing our number of times we're going to the breeding shed. It's saving the stallions. It's saving us on van rides. It's well worth it, but it does increase the number of twins, and twins are normal in a certain percentage anyway. So we want to check and make sure we don't have twins. And at 14, 15 days, they're very easy to move around, and we call it twin pinch to reduce one of the twins. We get a few more days earlier. This is actually a picture of twins, and I'm sorry it's not a very good picture. these are probably a 15-day and a 14-day together, and these are actually not too bad to get apart. But once you get to 16 days and definitely 17 days, they'll get together and they'll stick. And then we're going to have to ride them out. We're not going to be able to do anything about them. Luckily, about half of them self-reduce and take care of themselves anyway, but it's still more checks, more problems. When we pinch twins, we typically give the mare a shot of Banamine, possibly for a couple days, just for any inflammation from the vesicle that we broke open, and then we put the mare on Regimate for at least 60 days. And then just Regimate injectable progesterone. The injectable progesterone these days is long-acting product that you can give once a week. I like both of them equally as well. I think it's just kind of your management style and what you want to do. Give a shot once a week or give the oral every day. So we've got her pregnant. We're happy. Just as far as my ultrasounds, I do prefer to do a twin check if I can. Sometimes some farms we don't do it. It's economics. We look at the mare one time, and then we're going to come back and do a heartbeat check at 28 days. But in my perfect world, I'm going to check the mare at 15 days from breeding, and then I'm just going to come back in 2 or 3 days and look one more time and make sure there wasn't a late ovulation that was too small to see the time before that's in there. I'm paranoid about twins, and I'm aggressive about looking for them. We are going to do the 28 to 30-day check. We want to see a heartbeat. Want to make sure everything's growing. There's a relative percentage of those where we find those mares aren't pregnant, so it's definitely worth checking them, because we're going to want to go right back and breed those mares again if that embryo for whatever reason dies. Then typically after the 28-day heartbeat check, we're going to come back somewhere 40, 45 days and double check that pregnancy. And the reason that number of days is critical is that the uterus and the placenta actually forms what we call endometrial cups at around 40 to 45 days. And those endometrial cups don't go away for 120 days. They're there from 40 to 120 days. So if the endometrial cups produce a substance, and it's going to inhibit the mare from cycling back until she's 128 days. So I like to do that check around 40 days before the cups form, make sure everything's good, because then basically after that, the mare's done for the season. If we knew that she lost it right there at 40 days, 39 days, 38 days, then we can feel a little bit better about her being able to cycle back. Any questions?
Yes, on the subject of retired racing mares that have just come off the racetrack. I know often they've been given hormones at the track, and I wonder how you manage that, how you help them to get back to a normal cycling.
Honestly, I think patience is the best thing. I do think there's less hormones. There's less hormones now than there was for regulatory reasons, but I think there's endogenous hormones that are the same thing, and there's all kinds of supplements they're getting. So there's a lot of stuff. Those mares have to let down. They have to have some time. They have to get on a good feed program. Hopefully they start gaining weight. I don't have a magic bullet to get those mares going. You have to be patient, and you have to just exercise horsemanship with them, and cross your fingers and hope the sun shines. And it's amazing when the green grass and the sunshine come out, they do a lot better. They'll be nothing one week, and suddenly they'll be there.
Okay, thank you. It's a little more difficult up in the north.
It's the move to New York and that for me it's been different. It's different. And the other thing I have to say is that the breeding season's 2 to 3 weeks behind here than it is in Kentucky. Just from the weather. The mares are a little bit different.
Thank you, Scott. We greatly appreciate your time.